All attendees are in listen-only mode.
Hello, and welcome to today's webinar, Leveraging the Rankings for Community Action. My name is Ali Havrilla, and I'm a community coach with County Health Rankings and Roadmaps. And today I'm joined by my colleagues, Kate Kunkel and Karen Odegaard.
Hello.
Hey everyone, this is Kate.
This is Karen.
Hi Karen and Kate, great to hear you. And before we begin and go too much further, I do want to just comment on our format today. It will be slightly different than others. We'll have a few slides at the beginning and end of the webinar, and during the middle portion, Kate, Karen, and I are going to share our webcams as well as slides, and we're going to discuss strategies and resources to help you think about leveraging the ranking for action in your community. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. And I'd also like to take a second to acknowledge that this program is the result of contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. And before we get started, we want to orient you to the technology that we're using. The GoToWebinar attendee interface is made up of two parts. On the left is the viewer window where you'll see our screens and the slides that we're sharing throughout the presentation, and later on when we turn on our webcams, that's where you'll see Karen, Kate, and I. On the right is the control panel, and just above the questions box you'll find handouts for today, and that includes a PDF of our slides and a list of related resources that we'll be referencing throughout the presentation. You can also interact with us in the questions box that's in the control panel, and we'd encourage you to ask your questions throughout the webinar. Don't feel like you need to hold them all the way to the end. So let's get grounded in the purpose of today's webinar. Each year, the rankings release receives media attention in national, regional, and local media outlets. Today we'll explore strategies and resources available to help you capitalize on the momentum and excitement around this year's ranking release, which the date of the rankings release is March 29th. And as we move through today's session, I'd ask you to hold this question in your head. How might you use county health rankings in your community to move with data to action? So let's get started by reviewing our roadmap. Today we're going to start with an overview of county health rankings and roadmaps, and this is going to be a pretty quick overview, so if you're new to county health rankings and roadmaps, or if this is your first webinar, I'd encourage you to go on our website and check out the 101 introductory webinar, which is archived there. Then we're going to move into our discussion around the ways in which you can leverage the rankings for community action. We're going to share a new opportunity towards the end of the webinar and invite you to join us for a post-webinar virtual session to continue the conversation. And then we're going to spend a little bit of time answering your questions. So now I'm going to introduce three key images to help shape our conversation today. First, we're going to talk about the County Health Rankings Logic Model, then the Rankings Model, how we think broadly about health, and the third image that I'll share is our Take Action cycle. So right now you're looking at the County Health Rankings Logic Model, and this is our theory of change about how the rankings can be a catalyst for action to improve the health of everyone in a community. And so if I can ask you, guide your eyes over to the left, you can see that we start with population-based data from a variety of sources. Then we use the data to rank the health of nearly every county in every state. Each year, the rankings report release generates national, regional, and local media attention. And this report provides an opportunity to tell the story of the many factors affecting health in their community. Communities use these findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. Based on this deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally to make change. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in the communities. So, essentially when I think about this, the county health rankings aren't about numbers at all. They're about a call to action. They're a starting point for discussion in communities and not an ending point. communities will want to dig into their local data to further understand what's going on in order to know how and where to take action. So moving from the logic model, let's go ahead and take a look at the rankings model. Our work at County Health Rankings and Roadmaps is rooted in the theory that health is the sum of many parts. And some of you may have seen this image, and for others it might be new. It's the foundation of the county health rankings, and it demonstrates our broad definition of health. So walking through this model, I'd guide your eyes to the bottom, to the orange box that says policies and programs. And walking up, you can see the relationship between policy, health factors, which is the blue boxes, and health outcomes, green boxes. As you can see, the multiple factors impact how well and how long we live. Things like diet and exercise, education, employment and income, housing, water quality, and transportation are just some of the modifiable factors that influence our health outcomes, how long and how well we live. And so the third image, and equally important, is our take action cycle. Looking to the center of this image, it shows that in order to address health effectively, we need to harness the collective power of people from all across the community. No one organization or sector or group of individuals can do it alone. This is a multi-sector approach to community health improvement with community members who are residents at the center, as how we can address the many factors that influence health. So now moving from the center, I want to take a second and guide you to the action steps around the cycle, from assessing needs and resources all the way around to evaluation. And as you're looking at the steps in the cycle, you'll notice that work together and communicate encompass the circle, and that's because those steps occur concurrently as you're completing others. I'd note here that when you visit the action cycle online, you gain access to hundreds of practical tools and resources that will support you in your work. So now let's go back to our guiding question. How might you use county health rankings in your community to move with data to action? And right now we're going to start by looking at a couple of ways that communities have done that. So first, and we sort of alluded to this in the logic model, is that the rankings are the beginning of a discussion when it comes to thinking about community health and community health improvement. And from there, communities across the country are incorporating the county health rankings data into community health needs assessments and improvement processes. And then they begin looking at improvement strategies. And one of the things that we see is that the county health rankings are used to uncover the root causes of poor health in community and to focus efforts on factors that can lead to the biggest gains in health. The county health rankings also help support decision-making and policy change. Data and support from the county health rankings and roadmaps are used to inform policy and decision-making in support of action to improve health. And finally, one more way that communities are using the data is to track progress. As communities take action, they have used the data from the rankings and other sources to understand whether policies, programs, or plans are on track to improve health. And so now we'd love to hear from you guys, and Karen's getting ready to launch a quick poll asking you to respond to the question, how are you using the rankings data in your community? And as your poll answers come in, Kate, Karen, and I are going to transition to sharing our webcams, so just bear with us as we transition our technology.
Thanks, Allie. So we've got folks going ahead and filling out the poll. This is one where you can select all the answers that apply. So Allie walked us through some of the ways that we've seen communities use the rankings, and we are interested to hear from all of you. So we'll just give you a few moments more to see some of the ways that you all are using the rankings in your communities. And I'll just give it a few seconds more as folks consider this question. And I'm going to go ahead and close the poll. So thank you for sharing your experiences with us, and I'm going to share this with everybody so we can see that really we've got a nice cross-section of ways that folks use the rankings. You know, I think a lot of communities use it. We see there assess the health of a community as a starting point for assessment, and I think that that makes really good sense. It's a great starting point, I think.
Yeah, I'm excited to see the amount of people that use it to engage community members and leaders in health improvement. And I think we're hoping that some of you will share some examples of how you might have done that on the webinar today. So be thinking about those and share them in the question box.
Yeah, and I think more and more we're seeing folks using it to support decision making and policy change, and we'll talk a little bit today about how communities use this with key decision makers in their communities. So some great examples. So be thinking about some ways that you've used the rankings and how you might hope to start using the rankings in the future. Okay.
So we're going to start our webcams now.
All right, here we are.
And just 1 second, I'm going to see. Hopefully my screen is still sharing. All right. Well, so Karen and Kate, it's not only great to hear you, but now great to see you. And you know, so this has come out, but all counties can take action to improve health no matter where they rank. And it's not a race to the top, but it's about progress towards better health. And so while the release is an event, health is not. And so today I really want to break this conversation down into 2 parts. We'll start with using the rankings release, and then we're going to talk about using the rankings data and the model going forward from the release. So starting with leveraging the release on March 29th, Kate, why don't you kick us off, just sharing a little bit about why we rank?
Yeah, that's a great question because, I mean, in theory, we could just give people the data in their snapshots. But if we look at our logic model, we rank for a reason. And Allie, I think, are we going to put the logic model up? It's not on my screen, but we'll work on that in a moment. But yeah, so we rank for a reason, and it's in part to be a bit provocative. We want to get people talking. Ranks can be great for garnering attention. You know, if we just gave you data and you were trying to point out that maybe some of your data changed from year to year, people might not be that excited to or pay attention as much. But if they hear that you're ranked better or worse than a neighboring county, that might make them pay attention.
Yeah, I think one of the things that really makes this a good tool for calling attention to health in your community is that people are really competitive by nature, and they want to be better. So using the release of the rankings as a way to either start that conversation or continue a conversation about health is a really great opportunity to, again, use it as that call to action.
Yeah, and I think to Karen's point, using it as a call to action, the important thing there to think about is to be proactive. So it's why we're doing this webinar 5 weeks out from the rankings release, to help you guys start to think about how you can be proactive for the 2017 release. Think about how you can get your story out there. Who needs to hear your story? So again, in our logic model, we think about 2 primary groups. There's the media, who can help you connect with a broad audience, and other community leaders and partners who you want to engage in this work. And I think, again, 68% of you mentioned that you use this already to engage other community leaders and partners in this work.
Yeah, great. So let's, again, focusing on the logic model, can you give us some tips, especially around that media attention, how we can really harness that point within the logic model?
Yeah, I'm gonna put on my former journalist hat and think a little bit about how we can use this as a way to work with media in our communities. And I think one of the key things is to first remember that you control the story. So think about what story you want to tell. And I think you can use the release, again, Kate said we're several weeks out. You can use this to set some goals for this rankings release and how you can use it to advance your work. So that's number 1, control the story. Number 2 is really focus your story around action. What is it that you're doing in your community already? And how can you use it as a call to action for the community? How can either key decision makers or community members get involved in the important work that's already going on in your community? And finally, think about who can help tell your story. So this might be an opportunity to deepen a partnership or a relationship with somebody. It's also a way to think about, are there partners who could help you increase media attention, or who increase your credibility with some key decision makers, and how do you bring them into helping you tell the story? I think one of the things that we've seen over the years that we've been doing the rankings release is that more and more we're seeing other community leaders represented in news stories and media stories. So it's not always just the public health director who's out in front talking about the rankings, but it's people across sectors in the community. I want to just take a minute to say also that our Communicate Guide in the Action Center has some really great tips and tools for working with media and social media. One of the tools that we shared in the resources handout that you have in your handout section is the Media Advocacy Toolkit from M&R, and it's one of my favorites. It's really a deep and comprehensive toolkit that includes everything from interview do's and don'ts to tips for writing letters to the editor, things like that. So it's a really great resource.
Yeah, that, excuse me, yeah, that is a really great resource and one that I've used with a couple of communities, especially around rankings release. I want to add that if the media doesn't reach out or pick up your story, some communities have instead written letters to the editor or op-eds, just like what you were saying, Karen, that they can find in the M&R resource, some tips on how to do that. So that's something to consider as well. And one of the things that I know that we've heard occasionally is, how might communities think about their messaging differently depending on where they rank? And Karen, I'm wondering if you might kick us off there.
Sure. Yeah, so let's start with what a low-ranking county might think about. It's important to remember that being ranked lower in the rankings doesn't mean that your story should focus on what's wrong in your community. You can use the rankings as an opportunity to highlight the good work that's going on and as a rallying point. Again, remembering that you can control the story. You can decide what you really want to focus on. 2 of our RWJF Culture of Health Prize winners are also low-ranking counties in their states. So a really quick and important takeaway is that being low-ranking doesn't mean that there isn't great work happening in the community. So 2 of the communities, the Bronx in New York and Menominee County in Wisconsin, now these are about as different as you can get, right? So Menominee is a small rural county that shares its borders with the Menominee Indian Reservation, and the Bronx is urban and obviously, you know, it's huge. But both communities have used their low ranks as rallying points. So in the Bronx, the hashtag #Not62 campaign is a call to action, and it is a collective effort to create an environment where everyone in the community can attain the highest level of health, and so that means different things throughout the community. In Menominee, community members view their rank as a challenge, and they're working together to put policies and systems in place to address what they believe are the 2 root causes of many of their problems, poverty and trauma. So, you know, again, 2 ways that communities are really using the rankings as a rallying point and to highlight the good work that's already happening. Kate, I'm wondering if you can help us pivot a little bit to think about how the conversation changes if you're in a higher ranking county.
Yeah, definitely, because I think sometimes people think, oh, it must be so easy if you're at the top, because, you know, we want to celebrate, that's great news, but it actually comes with its own set of challenges, and so we're going to talk through how you might overcome those. So if you're a high-ranking county, people might sometimes think, wow, that's great, we don't have that much work to do. There might not feel like there's the same sense of urgency to create positive change around health in your community, or you might feel like it's harder to find a compelling story. You know, as Karen mentioned, our lower ranking counties sometimes feel like they have that natural rallying cry. That might not be the same in a higher ranking county. So what if you're near the top? I think one thing that's really important for all counties, but can be an especially important messaging tool for higher ranking counties, is to call attention to the differences in health within your county. So who isn't doing as well as it might look based on the county level data? Who has fewer opportunities for good health? Who isn't thriving? When I think about my own community, so we're based in Madison, and we're in Dane County, Wisconsin. Dane County ranks pretty well. We are 11 in health outcomes and 3rd in health factors out of 72 counties in Wisconsin in 2016. but we know that that's not the full picture, and our local health officer does a really great job of highlighting this in her messaging. So for example, a quote from last year's release, she really emphasized that while we're fortunate to be ranked in the top quarter of Wisconsin counties, that our community data shows that not all Dane County residents equally benefit from good health, and that looking at local data, we know that nearly 1 in 4 Madison children are overweight or obese, and Black and Latino children experience an obesity rate that's about twice that of white children in Dane County. So I think, again, that idea that Karen talked about, you have the opportunity to control the story. So tell a story that's going to engage people, that's going to get people interested in talking about health in your community, and that shows that while there is great work happening, there's work to be done, and that they can be a part of that.
Yeah, great. Those are really helpful, useful tips. I'm wondering now, going back to the logic model, if we can switch from talking about the media attention to how community leaders have used the report. And Kate, you were just sort of sharing one example. Karen, does anything else come to mind?
Yeah, well, 2 things that I want to point out. One is that we're getting some really great examples via the chat, so I'm trying to share those out so that everybody can hear, you can hear from each other. So be watching your chat and question box. But I would say that there are a lot of things that communities have done to engage partners, and I think the first thing to really think about is who are you trying to engage and why. That will help you define your approach. So you might consider hosting an event or a community meeting. You might think about scheduling a one-on-one conversation or maybe something else. And we'll talk about some of the things that we've seen done, but we want to keep hearing your examples, so do send in your ideas and your examples about how you've reached out to other audiences in your community.
Yeah, as those are coming in, I can get us started with a few examples just from, the communities that we've worked with or that have already shared with us what they've done. So elected officials are a group that many folks want to connect with. They have the power to change policy in many cases, so that makes a lot of sense. And at a state level, groups have held meetings with legislators, sometimes a legislative breakfast or event, and sometimes they've just gone and done individual visits and one-on-one meetings with specific legislators to share the state report and county level data for the areas that they represent. And we noticed that we have someone from Kansas on, and they've been a state that has done this many times with great success. But really, again, engaging at a state level, folks that have the power to change state level policy and think about how that may then impact what's happening at a local level.
Yeah, and at a local level, you might think about bringing this in a similar way. You might think about bringing this to the Board of Health or your county board, maybe to your mayor or other community officials. And this is probably going to depend on the size of your community and what, if any, relationship you might already have with these folks. But again, just like with the media, you want to approach this by knowing what story it is that you want to tell before you go in, and thinking about what are you asking them to do. So an example, I think, Kate, this was a community that you worked with, is Gem County, Idaho. And this community used the rankings to garner some attention around their low rank, specifically within health behaviors. And they used it to reach out to the mayor of their county seat, who has since then become a major champion of some policy changes that they've been able to accomplish there.
Yeah, they were able to use that to get some smoke-free policy passed and a lot of active living, healthy eating work done. And again, it was a community that overall looked like they were doing pretty well, but in that particular area we're last in the county, and really were able to draw in different people. And the mayor in particular was a huge win for them because, again, he really had the ability to make change happen pretty quickly. But I think we also want to think beyond policymakers, because communities are made up of lots of different people. So we've also seen communities host events. They hold community forums that are sometimes either aligned with the rankings release or in the weeks following the release, to really hear from the community and understand their stories. We always say the data is part of the story. What's the rest of the story? So really sharing the data with your community and then talking about again, if we want to think about how does this data look different from community to community within a county or neighborhood to neighborhood, and really ask the community, what's the story behind the number? What does this look like? What does this feel like? How can we make this different? And really engage the community members and other people in, leaders, educators, philanthropists, if we go to the Take Action cycle, the people in the center circles. And think about the best way to do this in your community. It could be in person. You might also think about how you can use social media. If you follow County Health Rankings and Roadmaps on Facebook or Twitter, we will be tweeting and posting graphics and other fun tidbits leading up to the release, and we actually do this all year round. But feel free to retweet and repost those graphics to start to generate some energy and buzz. This is coming. And then, again, using that energy, harnessing that energy to, on March 29th, share your community story, get that out there. What are you doing to make your community a healthier place for all, and how can people that are following you on those social media sites get engaged and be part of that conversation, maybe add to the story?
Yeah, I think this is another important opportunity to think about who it is that you're trying to reach, who your key decision makers are, and what are they paying attention to. So are they regularly citing letters to the editor, or do they spend a lot of time on social media? And thinking about how you can use those opportunities to reach them.
Yeah, so this is really great conversation, and I'm wondering, one of the questions that came in, and Kate, I'm thinking you can answer this, is what time specifically on the 29th are the rankings available to folks?
Yeah, so they're released at midnight Eastern time zone. So you kind of get a little bit of a sneak peek if you live Central Time or earlier or later. But yeah, so they'll be available and ready to go on midnight Eastern Time on the 29th. So you can get up bright and early and start using them right away.
Great. And I think, you guys did such a great job highlighting that it's, regardless of who you're connecting with, the media or other key audiences, like legislatures or community groups, the rankings are really that opportunity to start to tell your story that you want to share, and that it's not necessarily the story of a ranking or a number, but of the work that your community is doing together. And so we'd encourage our participants today to really think about how you and how you can work with others to craft your story, and that no matter where a county ranks, every community does have the areas for improvement and also strengths. So use the rankings and other data to identify some of those areas of strengths, but also go beyond the data to continue thinking about what opportunities exist. So the data is part of your story, but what's the rest? And think about the good work already happening that might not be reflected in the rankings data just yet, and that actually goes to, one of the questions that had come in was concerns over where our smaller changes might not yet be reflected in the rankings data. So just remember to continue to blend the data with the community story as well. So now, before we pivot to using the rankings beyond just the rankings release date, we wanted to pause here and answer a couple of questions that have come in. And maybe one that could get us started, and this came in from the pre-registration report, how can you use the data to get the community involved?
Yeah, so I can start with some ideas, and I think we've talked about some of this already, but I think again, using the data as the starting point for the conversation. So whether you're holding a community forum, whether you're putting something out on social media, whether you're going and having a one-on-one conversation with a potential partner, or maybe having going to a neighborhood center, and asking people, so here's what the data says. What does this look like in our community? What are the things that are helping or making it harder for people to be healthy? And kind of getting a sense, does this jive, does this resonate with people, and what are they feeling and seeing in the community as potential issues that are making it easier or harder to be healthy? I think always just using the data as the jumping off point for a deeper conversation.
Great.
Yeah,
I don't know if anyone else Oh, go ahead, Karen.
Yeah, I would just add that I think some of the examples that we're seeing coming in are great ways that you all are using the data to reach out to different groups in your communities that that you think either need to see this data or need to respond to that data. I think, and that's a key thing is, as Kate was saying, how does the community respond to the data? How does that resonate with their lived experience in your community?
Yeah, when we were
Great.
discussing that the rankings are available at midnight, I was thinking, is anyone else thinking about a Midnight Madness event around health instead of basketball? Any sports nuts out there? The first community that does that, let us know.
Yeah. Put together a toolkit.
So as we start to think about transitioning the conversation to really that second part, right, using the rankings beyond just the rankings release date, how could a community use this year's rankings release to share about their efforts and impacts that are already underway in their community?
You know, I think a lot of that goes to your messaging. And I think that the rankings are just, again, that's, I feel like I keep saying it, but it's using this as an opportunity to control the story. And you know, it might be a pivot where you say, well, the rankings continue to reinforce why we're working to address this issue, high school graduation or income or whatever it is that you're working on in your community. But, or like you may use it as an opportunity to highlight your partnership and the great work that people are coming together to do. You know, the county health rankings emphasize that we have a role to play in making our community a place where everyone thrives. And so we're bringing all of these partners together, and you can get involved too. You know, there's just some different ways that you can use this as a pivot, and again, thinking about what are the goals that you have associated with this rankings release.
Yeah, I think it's important to remember that the story is not the rank. The rank is the hook. Mm-hmm. But the story is health in your community and what's happening around health in your community. What are you already working on? And who else needs to be involved and engaged? And so thinking about the different, and depending on who you're thinking about engaging, that's going to have the most impact to do that. But the rank is the hook. The rankings are the hook. And it's using that as the platform then to be able to share your story and the story that you really want to get out there.
Yeah, and so I think, Karen, I just heard you say this, you know, that the county health rankings can emphasize that we all have a role to play in making our community a place where everyone thrives. And so continuing that shift, you know, to thinking about the rankings all throughout the year, what are some of the ways that communities use the rankings and other data to explore differences within your community?
Yeah,
or within their community?
Yeah, good question. I think, you know, we often will say that the rankings data are a starting point, and it's really a snapshot of your county's health at a point in time. But to really understand what's going on, you're going to need to dig deeper. And so we provide some guidance on how you might do this in two key resources, the Using the Rankings Data tool and also in our Assess Needs and Resources guide. That's in the Action Center. But some of the questions that you might want to ask when you're thinking about this, when you're looking at a particular measure, are: does this measure differ across age groups? How does this measure vary among racial or ethnic groups? How does this measure vary across groups within different socioeconomic characteristics? So thinking about different ways to sort of break that data down, those measures down. And then also, are there specific zip codes, neighborhoods, or school districts where the measure indicates a localized problem or opportunity? And we link to some data sources that will provide demographic or sub-county data for some of our measures. And we also always encourage you to look for local data sources that will help you answer these questions.
Yeah, and I think you know, at a county level, you always want to dig deeper and figure out what's happening within your county, but I've definitely seen at least a handful of some of our state level partners on the webinar today. And so We do have another resource, the Health Gaps Report, and that can be particularly helpful if you work at the state level, and that can help you understand gaps within your state. So the Health Gaps Reports were released in the fall of 2015, and they show what's driving health differences across each state and how those gaps could be closed. So again, this is just another way to frame the conversation, especially if you're thinking about talking with state legislators or other potential partners at a statewide level. To show really how much healthier your state could be if everyone had the same opportunities for health. So we are the county health rankings. We are really thinking about health locally, but we recognize that there are people that are working on health at lots of different levels, and understanding, again, sort of not just what's the health of your state, but what are the differences in your state and where really are there opportunities to close some gaps can be really powerful messaging.
Yeah, and along with those reports, we also have a health gaps discussion guide that is a really helpful tool for folks who want to start the conversation. So as we mentioned before, data is part of your story, but it's not the whole story. So to really understand what's happening in your community, you need to engage people in the community to understand, you know, who is most impacted by poor opportunity and poor conditions for health, and what changes can be made to make sure that everyone has a fair chance to live a long and healthy life. And this toolkit, this conversation guide, is a really great place to start with having some of those conversations with folks in your community. And I just shared a link to both the state health gaps reports and to that discussion guide in the chat.
Great, thanks, Karen. These are great tips on how we can use the rankings and other data resources as a starting point to start to explore and understand gaps within our communities. Let's talk a little bit about some of the other resources available from county health rankings and roadmaps to help them think about how to improve health throughout the year.
Yeah, so I think one thing that people can really think about using the rankings for is to help you sharpen your focus to the areas of health that need improvement. And again, it's a starting point to maybe suggest areas where more in-depth analysis might be helpful. And how you determine that, we do have a way in the snapshot that you can turn on areas to explore. Those are areas that might be a good starting point, but you might look at some data that's not showing up in that and still think that's something that we want to learn more about. I also think if you're really just starting this conversation about health, we know that people are in really different points in this process about how to improve health in their community. If you're in the earlier stages of this and are really starting this conversation, then the Work Together guide and the circles with the different partner groups that I mentioned earlier that are at the center of the Take Action cycle can help you really start to think about who else you should invite to join the conversation. And then the Assess Needs and Resources guide can show you how to find other information to get a fuller picture of health in your community so that you can really begin to figure out where you should prioritize your efforts. And again, I think using the data in the rankings to narrow down where you might really want to do some more digging for additional information.
So we've just referenced the Assess guide and Work Together guide. I think a little earlier I talked about the Communicate guide. You're going to find all of these in the Action Center. So I just shared a link to the Action Center, and you can get in and explore all of this guidance and the tools that are there to help you now as you think about preparing for the rankings release, but also throughout the year. Ooh, Allie, we just lost your audio.
Oh, sorry, I was on mute. Drowning out some of the background noise. But so what I was saying, you know, I was wondering what guidance or advice you have for our audience members who are with us today who are thinking, you know, we've done an assessment and we have some priorities. So either what's our next step or how does all of this help us?
Yeah. Well, first, I think this data can help reaffirm that you are working in the right areas. But just as you can use the rankings data to sharpen your focus, you can also use it to broaden your focus. So this is especially helpful when you're thinking about how you might create positive change around some specific areas and really, I think, start to back up into root causes. Which again we saw as people were thinking about using the rankings data that folks are thinking about using it to identify root causes, but again thinking about that a little bit more as a way to use those data. So if we just want to walk through an example, we know that lots of communities are concerned about obesity. And so you're likely looking at both your obesity rate, but also your data for food, environment, and physical activity. So if you think about the food environment, what are some different things that make up the food environment? Well, our measure is specifically thinking about access to healthy food and being able to reliably put food on the table throughout the year. So what contributes to those things? And again, I always think of this as kind of backing up and asking those why questions. So accessibility might mean, are you close to a place where you can buy food in your neighborhood or in other areas that you frequent, like at your kid's school, can you get healthy food, or where you work, do you have access to healthy food? But it might also be whether your community has transit options that allow you to get to retailers with healthy food options. Being able to reliably put food on the table throughout the year, that's likely related to the price of food, but also to other things like living wage incomes and affordable housing. What else are you spending your money on? It might also be a question of whether people have the knowledge and the resources to prepare healthy meals. It can be hard to prepare healthy meals if you're working several jobs or if you don't have a complete kitchen. So complete kitchen facilities is one aspect of our measure on severe housing problems. So now just thinking through, backing up that one area of focus, we've broadened out to think about social and economic factors, health behaviors, and the physical environment areas of our model, all by just talking through the food environment.
Yeah, Karen, as I listen to that, that makes me think, first, that's a lot, right? It can feel big, and in some aspects, maybe we've opened a can of worms. So let me bring us back to our core values and that idea, thinking to the action cycle, that's why we say it takes everybody. People who build roads, teach kids, pass laws, create businesses, volunteers, community leaders, individuals from all walks of life. No one expects that one group could do all of this on your own. But what we wanted to share was the bigger picture, and maybe plant some seeds about how you might work with new and existing partners as you think about the multiple factors that influence health. And Kate, I think this is sort of shifting gears just a little bit, but I know sometimes we hear from communities that they have better local data and they don't really see a way to use the rankings, and I'm just wondering if, as we get close to the end of our discussion portion today, if you had any thoughts on that.
Yeah, and depending on the community, that's very likely true. We have some real constraints in providing data to counties across the U.S., so there are lots of communities who do have better local data. It's one of the reasons we say the rankings are a starting point, and that you should dig deeper and use local data that's available to you. And for small rural communities where maybe this is kind of the data that you generally do see, again, going to the Assess Guide to think about how else can you collect some primary data from your community. Our data isn't intended to be the end-all and be-all or a complete picture. It's, again, a snapshot and a starting point. But I do think that this is really where we can think about the rankings model and all of the factors that influence health. I think sometimes it's easy to get lost in the data. So I think especially even if you're talking to a group that feels a little overwhelmed by all the numbers that they're seeing, returning to the model to ground in the big picture again, really looking at what influences health, where we can have the most impact to make sure that people have an opportunity to be healthy, and really taking some time to explore how those different factors connect to each other in your community, just like in the example that Karen just walked us through. And it's a great tool to use to connect with partners. We're seeing the model pop up in all kinds of presentations now. Initially, it was lots of public health and hospital folks that were using it. We're starting to see more chambers of commerce, more United Ways, community partners, philanthropy, starting to use this model to think about health and community health. And so if the data itself isn't working for you, turn to the model to help frame conversations with partners about how they can play a role in creating a healthy community.
Yeah, great. And so we've touched on this, but I really think it's worth repeating that the rankings do help us see that where we live, learn, work, and play influences how healthy we are and how long we live. And as I've been reflecting on the examples that Karen's been chatting out today, it gives me great hope that there's a lot of really great work going on and some people doing some really great work around community health improvement and making their communities healthier. And we just really wanted to quickly share as a resource, and if you think back to our logic model of when you're looking for those evidence-informed policies, programs, and strategies, we'd encourage you to check out What Works for Health, which is another online resource available within County Health Rankings and Roadmaps. And right now I'm going to ask Karen to share a little bit about our coaching program, and we're actually going to transition and stop sharing our webcams. So yeah. Karen, I'll turn that over to you while we shut our webcams down.
Sure. So as you think about the ways in which that the rankings might spur or support action in your work or community, we are going to encourage you to, and we always encourage you to contact us, to reach out to us and connect with us as coaches. So you can use the Get Help buttons that you'll find across the site to reach out to our coaches, and we can work with you to answer questions about the next steps on your site, on our site, or in your community. And we provide strategic guidance and opportunities to build on your community's unique strengths and skills. So from data scientists to community coaches, we have a whole team of folks who really stand ready to support you to help you take the next step in your community. So check that out.
Yeah, great. Thanks, Karen. Now we'll let you get your webcam turned off.
Thank you.
So here we just wanted to spend a couple of minutes recapping all that we've talked about and really sharing, how can you use the rank, what as an opportunity to support the great work in your communities. And first is to start the conversation, create awareness and a sense of urgency about what are our issues and what are we improving. Also use the rankings to investigate the differences. Use digging deeper and other data tools to understand the differences between groups of people in your community. You can also use rankings to ask the community, what's the story behind the number? When you start to talk about the story, people start to come with ideas and solutions. Focus those ideas and solutions on the drivers that most influence health, those policy systems and environmental conditions that create opportunities to improve health for all. Dig deeper into the rankings and explore root causes. While all health factors affect health outcomes, be sure to focus on the social and economic factors as they contribute the most to poor health. Use data as part of the community health assessment process to help determine the most effective strategies, especially those strategies that, if directed towards those in greatest need, will help reduce health disparities. And finally, and I don't think we can say it enough, there's an incredible opportunity to engage your community, from neighbors to coworkers to educators, business leaders, and elected officials. Join together and think about how you can use the rankings to move with data to action. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. And we're going to start our question and answer in about 2 minutes, but before we begin, I want to take this opportunity to invite you to join us for a continued conversation on this topic next Tuesday, February 28th at 2 p.m. Central. We're offering what we're calling a post-webinar conversation, which is a chance to dialogue with your colleagues and us about using the rankings to move to action. And we're hoping it will be a facilitated conversation, but we're hoping that it's interactive and that we really have a chance to dig deep into some of your questions. So a couple of notes about the post-webinar conversation next Tuesday. Karen is chatting out a registration link, and we'll also follow up with the registration link via email. We're using RingCentral as our technology platform, and we'd encourage you, if you're not familiar with RingCentral, to join 10 to 15 minutes early to get oriented. And then finally, there's 3 reflection questions on the screen, and we would encourage you to maybe, if you're interested in joining us, revisit those questions after today's webinar and come prepared to discuss them. So again, a post-webinar conversation continuing focused around this topic today, and it's February 28th at 2 p.m. Central, and we'd love to see you there. And I think with that, we're going to turn it over for questions.
Yeah, and Ali, I know you've been looking at a lot at the slides, so I can ask the first one if that's okay.
Yeah, that'd be great.
All right, so Paul says that he's a low-scoring county in a low-scoring state and fears that the small advances won't be reflected in upcoming rankings relative to other counties. Any advice on how to keep the interest up if we think we're doing good things but losing ground, or if that's not really showing up, you know, the good things that are happening aren't showing up? And I can start with a response, because I picked it because I had one. But I think there's a couple things here that come to mind for me right away. So one is, this is where local data becomes essential. We are going to have a new resource this year that gives you a bit more information on how to use the rankings to measure progress, but the rankings really aren't the best resource for that. You're going to want to have local data, an evaluation plan really, and local data. And again, when you have then the opportunity to share your story, this is where you can use that local information to say, you know, here's where we started, here's where we are now. And it's okay if it looks different than the data that's in the rankings. Because I think the important message there is that data takes some time, and especially when we're getting data at a national level, it's collected at a local level, it's funneled up often to a state or to a national resource, or it's coming from a national resource, there's lag time. So we use the most current data that's available. That's not always current enough to show real change in your community in the last year or two in particular. So I think as much as you can have local data to show what's happening and the changes that you're seeing in the community. Again, this is where stories can also really help. If your data isn't quite caught up, sharing community stories of how people are talking about this and the energy that's been created and what you see happening can help to generate that interest and keep that momentum going a little bit.
Yeah, I think this is similar to, or kind of runs into another question that we had about, you know, how do we measure the impact of our efforts? You know, if we're trying to get out there and say you should quit smoking, how do we know if that's working? And so I think what you said, Kate, about looking to some local measures when you can, thinking about using story as a way to share successes and to kind of keep the momentum going. And I would also point folks to the evaluate guidance and tools that we have in the Action Center, I think, as another great place to kind of dig in and start thinking about, all right, what can I do to evaluate the results of either a media campaign or you know, a policy change that we're working on in our community, and recognizing that that the rankings, you know, coming out on an annual basis are going to show you, it'll take a little while to see results in the rankings, either in the measures that we include because of the data time lag and various reasons why you may not see an impact as quickly there as you might like to. So what are some interim measures that you can be looking at and thinking about different ways to, again, keep that momentum going?
And I think this is a great place for a plug for coaching again. We have 11 community coaches who can help to answer some of those specific questions. So if you're doing this work in your community and you're a little stuck on what are some maybe interim measures, or you know, how can we get started with an evaluation plan, that connect to us, ask, you know, the buttons on the website, they all say different things. We answer those questions, so feel free to reach out, and we are happy to help you think through or point you in the direction of some specific guidance that might be helpful.
Great. I'm wondering if we have time for one more question. And Kate, I'm thinking, I know I've heard you talk about this before, so maybe throwing this one to you. This comment comes in. It says that although our county ranks quite high in health outcomes, there's a gap between the rank for our health factors. And so I'm wondering if you just want to real quick talk about what a county might do around the rankings if there is a difference between their rank in health outcomes and health factors.
Sure. So it's important to understand there's really two different ranks there. Health outcomes looks at length of life and quality of life. So how long are people living? How healthy are they? And then health factors is a measure of those different things that are going to impact health down the road. And so it's quite possible that those ranks look really different because they're measuring different things. Yes, they're related, but you know, there's again that time lag there. So depending on which one's higher might depend on how you message that. And it sounds like this is a high health outcomes ranking and a lower health factors ranking. So that means that there's going to need to be work to be done to make sure that your health outcomes don't start to slip, that the things that are influencing health, that those things aren't going as well. And again, the important thing there is when you think of a rank, you know, this is relative to other counties in your state. So important to also look at those data pieces and say, so what's not going well here? And I'm looking at this question. It looks like the physical environment is where you're seeing some lower numbers. So the physical environment only makes up 10% of your health factors ranking. So this is one where I'd probably want to sit down and look at your snapshot and say, so it might be in part the physical environment, but that might not be the whole story. So let's look at the whole picture and see where else things are going on. And then if it is within the physical environment, what are some things that are happening there? So there we think about air and water quality, and we think about housing and transportation. So what's happening? What are these connected to? How can we make improvements there? But again, yes, we want to see our ranks improve, but mostly we want to see health in our community improve. And so even if that's what's bringing your rank down, that might not be the most important thing for you to be focused on anyway. There's lots of different pieces that go into that conversation. And so this is where it's really important to look beyond the rank, look at the data, and explore what's really happening and where you can have the biggest impact.
Yeah, Kate, the only thing I would add to that is using the rankings data section of our site, I just chatted out a link to that, can be a really helpful tool to use to just kind of work through what am I looking at on my snapshot, what additional questions do I want to be asking to really understand what I'm seeing here and to be thinking, again, digging a little deeper into what's happening in our community, which can be some helpful ways to kind of take the next steps from a snapshot to actually using it to put it into action.
Great. Well, as we wrap up here today, and I should let everybody know that Karen, Kate, and I are more than happy to stay on past the top of the hour if folks still have questions for an additional 10 or 15 minutes. So if you're interested, stay on the line after we wrap up and we'll continue to answer questions as they come in. I also want to clarify, it looks like we might have had a typo on a past slide. The post-webinar conversation is happening on February 28th at 2 p.m. Central. Karen's chatted out that registration link, but we'd love to see you there if you're interested in continuing this conversation. We also would encourage you to check out our upcoming and archived webinars on our website, and also stay connected with us through Twitter, Facebook, and we also have a newsletter. So we'd encourage you to join us via any of those channels as where your interest lies. And finally, 2 reflection questions as we wrap up. We always encourage you to think about who else you need to share this information with, and maybe just write down one idea for action that you're taking from this webinar. And with that, Karen, Kate, and I say thank you. This was really fun, and we appreciate you joining us today.
Yeah, and so I know lots of you probably have meetings at the top of the hour, but again, if you are interested in continuing the conversation for a few more minutes, we can try to answer a few more of these questions.
Yeah, there are a handful of great questions here that I think we can dig into a little bit more. And again, I think, that post-webinar discussion will also be another opportunity to continue to dive into some of these topics.
Mm-hmm. So I'm just looking for people who are still on the call. So it looks like Bob had a question about the how do red states compare to blue cities for health status, and are there examples of this type of analysis that are highly relevant to improving on the ACA? So I'm going to sort of skirt that question a little bit by saying I don't know that we have data on that specifically, but last year in our key findings report we did do a highlight of urban versus rural communities and what health looks like comparing those two types of communities. So that's, I get, not the same thing as red states versus cities, and I don't know that we want to get into that anyway, because part of the purpose of county health rankings is to show that there's a lot of variety within states, that every county has challenges and things that are going well, and there's variability regardless of what your state looks like as a whole. But certainly we do see some trends, and the report last year, the key findings report that highlighted the urban versus rural, showed that rural communities really are in some areas falling behind a bit more. There are specific, I'm going to try to bring this up right now as we're talking, but in specific areas that their premature death numbers are actually getting worse, while urban communities are actually seeing those numbers improve over the same period of time. For things like injury deaths and I think obesity rates, rural communities are seeing higher rates of those things. So there are certainly differences when we look at type of community, when we think about place, and where people are living and what kinds of opportunities they have. And I think that can be a helpful starting point, but certainly want to be careful about just generalizing that to a political affiliation. And I think, again, there's examples on both sides of communities that have similar challenges or not. But I would suggest looking at, and you go to the website, the key findings report is under the tabs, under the resources tab, there's a reports place, and the key findings report might be an interesting place for you to start with to talk about that.
And I just chatted out the link to the 2016 Perfect. Key findings report as well. So I think that thanks for reminding us about those reports, Kate. I think that those are really helpful, and you can watch for the 2017 key findings report with the 2017 release as well. So we had a question about from Annette about suggestions for building sustainability into local health coalitions, and I think I'll open it up to Allie and Kate first and then chime in, I guess, if I have any follow-ups to it. But I think that this is a great one for us to talk about as coaches, some of the work that we do with communities. And I think if this is an area that you're really focused on in your community, Annette, then thinking about reaching out to coaching may be a really great option for you. But I'll kick it over to Allie and Kate first.
Yeah, I agree, Karen. So this is Allie, and I think that is a great question. What came top of mind for me, and probably bigger than we can get too deep into today, is thinking about working across silos and making sure that your coalition structure is set up to allow you to capitalize on the resources both within your coalition but also the existing work within your community. And we have some a great starting point for you might be to look at some of the archived webinars that we have on boundary spanning leadership and setting up a team blueprint, because I think those are two great resources that we've worked with communities on that can really help you think about sustainability.
I'll share a link to some of that, so watch your chat link.
Thanks, Karen. And Kate, if you're talking, you might be on mute.
Oh, yeah, I just realized I was muted. Sorry about that. Yeah, so I think, there's the making sure that your coalition is functional to be, sustainable and in it for the long term, because, the community health improvement work isn't fast. This work takes a while to really create systems change in your community, which is what is really needed if we're going to really see a big difference. So I think another thing to think about is what kinds of work you're thinking about doing. So lots of coalitions have traditionally done programs. And there's nothing wrong with programs. They're an absolutely important part of behavior change and of health change. But we also need to think about repairing that with systems change, with environmental changes, and with policy change to support that work. So really helping you think about, if we're going to have sustainable change, not just is our coalition sustainable, but is the work we're doing sustainable, really moving from just thinking about program to really thinking about policy changes that might support that work. I think programs are great to get attention and to get energy going, and again, they're an important place, but they often aren't a great place to sit within a coalition because they require a lot of work. And they really belong in organizations in the community. So I think to Allie's point, what else is happening and who else is doing work in the community? And then the coalition really focusing on how do we create an environment that will support the good work being done by these different organizations and really be catalysts for change in the community. So we talk about sustainability in a couple of places throughout the Action Center, so certainly in Work Together when we're thinking about sustainability of a coalition, but also in Act on What's Important when we're thinking about the sustainability of the change that you're making in the community.
Yeah, I think that you guys really covered it. So I'm not sure that I have anything more to add other than that I did chat out the link to the Work Together, to Managing Boundaries in the Work Together guide, and then also, as Kate said, checking out the Act on What's Important guide in the Action Center is also another key place for some guidance there. We have two questions that I think are related, one from Ashley, who looks like has left, and one from Christopher, about providing some examples on how county health rankings and roadmaps has been used or could be used to approach health disparities and health inequities. And Ashley's specific question was about describing disparities without collecting primary data. So what are some options for really digging into that data if you're not able to collect your own data?
Yeah, so I think,
go ahead.
This is Kate and I can start. So I think one thing to think about is at what level are you working and where are you trying to communicate disparities between or within which groups? Because county health rankings as a whole really does communicate that there are disparities, that based on where we live, that impacts how healthy we might be and the opportunities that we have to be healthy based on the county that we live in. We also recognize, though, that not everyone's working at a county level and that there's differences within counties. We've talked about that a lot today. So again, the Using the Rankings Data tab has some links. They're listed by state to other data sources that can help you find which data might be available at a sub-demographic level or at a sub-county level or at a different demographic level. It's going to depend significantly on the size of the county you're in and the population within your county, whether or not those things are really available. In smaller, more rural counties, it's hard to get data broken down below a county level. In some cases, the county is the census tract, so even when it's available at a census tract level, that the border is the same with the zip code. And so it really depends on size of community, how easy that sort of sub-county level data will be to find. But again, I think when you think about collecting primary data, community conversations where people are sharing information, that's data. It doesn't always have to be a survey. Photo voice is one of my favorite tools to share with people. It's, you know, and now that lots of people have smartphones, it's getting easier, although if you live in a community where that's not true, thinking about disposable cameras and those kinds of things, but it's asking people to take pictures and share them about what makes your community healthy or not, or giving them a specific question to answer to. So there's lots of ways to collect data that we don't always think about, or there's information we can collect that also tells the story, even if it's not, it may not be something you use to measure progress and track change over time, but I think to communicate that people living in different parts of our county experience very different realities when it comes to opportunities for health. Pictures can be fantastic to communicate that, as can, again, kind of community listening sessions.
Yeah, and this is Allie, and I would just highlight again the questions that Karen shared earlier on that are also included in the assess guide from the Take Action cycle, thinking about how a certain measure might differ across age groups or vary among racial or ethnic groups, and you could even, you know, you could start to layer those questions as you think about it. How does this measure vary across groups with different socioeconomic characteristics? And then are there specific zip codes, neighborhoods, or school districts where the measure indicates a localized problem or opportunity? And I think, you know, so thinking about your ranking snapshot and looking at some of those measures and then applying one or all of those questions might be the start of a conversation around equities, inequities or disparities within a community.
Yeah, so I'm seeing a couple of questions that people are asking how what the best way to connect with us or establishing a plan to contact us. So again, if you go to the website, across the website there are several places where you'll see buttons that say Contact Us. If you click on that button, it will send you to a little form that you can fill out. That comes as an email to our staff, and it's the best way to reach out to us right now because that will get triaged then to the person who can best answer your question or the person that makes the most sense based on kind of what your need is or where you're from, of who you should connect with. So if you countyhealthrankings.org, at the very bottom of the home page, but also located on lots of other pages if you're poking around on the website, that Contact Us button is a great way to reach out. We do respond to all of those emails. They don't go into a black hole.
Yep, and I just chatted that link again for just the Contact Us section. So just reach out to us that way. As much information as you can give us is great, but we'll be in touch with you regardless. So we look forward to hearing from you.
And go ahead.
Oh, sorry. This is Karen. I was just going to say I just responded to a question in writing that I think I shared out with everybody, but just wanted to call attention to it that there's a question about overcoming the lack of a budget to get community stakeholders together. And I know that many of the communities that we work with feel like they're very resource strapped. So I shared out a link to a section of our Act on What's Important guide that talks about making a plan for your resources, and it has some really great tips and tools in there that can help you think about what resources do we already have and how are we making the most of the resources that we have, and thinking about, you know, the resources aren't just money, but how do you really make the most out of the partners who you do have coming together or who you can bring together and what they might have available to offer through in-kind contributions. So I just wanted to call attention to that and that link that I just shared out for developing a resource plan.
Great, thanks, Karen. Well, it looks like we've gotten through the questions from all the folks that are still with us, and we're sort of coming up to the top of our time. So I think we're at that point in the day where we're going to say bye to everybody, but this webinar will be archived, so if you're interested, feel free to go back and listen. I know we shared a lot of information today. And as Kate and Karen said, feel free to reach out and connect with us. We will get back with you and follow up, and we'd love to hear from you.
Thank you.
Thanks, everyone.